Runner's knee, or patellofemoral pain syndrome, is the most common cause of non-traumatic knee pain. Up to 2.5 million runners are diagnosed with patellofemoral pain syndrome in a given year. Patellofemoral pain syndrome is characterized by pain around or behind the kneecap or patella. It has been estimated that 1 in 4 active adolescents and adults complain of patellofemoral pain. The occurrence of patellofemoral pain is much higher in athletes and military personnel, where the prevalence can increase to as high as 40%. Even though this condition is referred to as runner's knee, patellofemoral pain syndrome occurs in a large variety of athletes and activities. Researchers have identified over 135 risk factors for developing patellofemoral pain syndrome. In addition to running, these weight-bearing risk factors include such activities as squatting and stair climbing. However, you do not need to be active to develop patellofemoral pain or aggravate your kneecap pain. More than half of people with patellofemoral pain syndrome experience pain with prolonged sitting. It was once referred to as moviegoer's knee. Patellofemoral pain is more prevalent in women than men, but yes, men have patellofemoral pain as well. In the 1990s and 2000s, this was primarily a younger person's knee condition. However, in the 2010s, 2020s, the prevalence of patellofemoral pain is actually higher in the older 50-plus year old population as compared to adolescents in the 20 to 30 year old population. As mentioned earlier, the majority of aggravating factors occur when we are performing our day-to-day weight-bearing activities. Most of these weight-bearing activities involve what is referred to as pathobiomechanics or improper movement patterns. This is also referred to as weight-bearing malalignments. This is indicated in the yellow box at the top of the diagram. Sometimes patellofemoral pain is simply caused by excessive use or excessive loading, such as performing a high-demand, unfamiliar activity such as running, a 10K race, or going backpacking. However, patellofemoral is more commonly caused by repeated weight-bearing activities with the lower extremities or trunk in a malaligned position. These malalignments can be caused by a variety of factors, including muscle weakness, muscle tightness, moving improperly, which is referred to as motor coordination deficits, or a joint restriction or dysfunction. These weight-bearing malalignments often occur proximally at the hip, pelvis, or the spine. However, sometimes these malalignments arise distally from the lower leg and foot. Examples include tight heel cords, or tight calf muscles, or even a pronated flat foot. Regardless of from where the source of these weight-bearing malalignments originate, it starts a chain or cascade of events that I referred to as the patellofemoral pain waterfall. Malalignments cause the alignment angle of the femur or thigh bone and the tibia, your shin bone, to increase. This is referred to as increased or excessive dynamic quadricep angle, or simply put, the Q angle. This increased Q angle causes the kneecap or patella to leave the safety of its neutral position, and it moves laterally towards the outside of your knee joint. The lateralization of the patella results in the kneecap being compressed against the lateral portion of the femur bone, which is referred to as your trochlear groove. This results in a decrease in the contact area between the patella and the tibia. In physics, pressure is calculated by dividing force by the surface area. Simply put, the smaller the surface area, the greater the pressure and joint stress. Thus, this excessive joint stress between the patella bone and the femur increases stress of the cartilage on the undersurface of your kneecap or patella. Over days, weeks, and months, this can be manifested as patellofemoral pain in the younger population. Over years, if not corrected or controlled, this excessive cartilage stress can lead to more serious cartilage or even bone changes. This is typically seen in the 50-plus-year-old population. I refer to this population as the silver athletes. The undersurface of the 50-plus-year-old patella receives a black eye, or a bony or cartilage change. Physicians often refer to these cartilage or bony changes as osteoarthritis, which is correct, however, often carries with it a negative stigma that movement is harmful. This lack of movement also promotes a sedentary lifestyle. Research out of the United Kingdom suggests that movement and proper exercises are exactly what this population needs for better joint and knee health. The key to breaking this pain cascade is correct and proper movement. Your